Okay, now we're going to talk about the progression of dementia. People with dementia each have a difficult pattern of problems and different speed of decline. Their abilities may change from day to day, or the person's abilities may decline more slowly over several months or even years. What is certain is that the person's ability will decline. Stage 1. Often family members are not aware of this amount of difficulty the person is having until late stage 1. The person with dementia will often deny there's a problem and make excuses for why something happened. The person will often blame others for their mistakes. Steps the family can take. Write reminders on a calendar or specific notepad. Label or put pictures on a cabinet, closets, and drawers. Keep a list of phone numbers beside the phone when help is needed. Ask a family member to assist with the bill paying and money management. Get a complete physical to rule out an illness or disease causing memory problems such as vitamin B12 deficiency or thyroid problems. Stage 2. This is your moderate to mid stage. For the 1 to 7 scale, it compares on stages 5 to 6. Now, what that means is when they go to the doctor gives them a scale of where they fall under their cognitive. So it could be anywhere between 1 and 7. And this compares to stage 5 and 6. Some of the major gaps in memory, especially recent events, the ability to problem solve and handle complex issues is lost. The memory loss is now interfering with daily activities. The person needs more cueing and prompts to perform ADL care. The ability to cope in new situations or unfamiliar surroundings is decreased. The person that is fading away. The middle stages last about 2 to 5 years. The person may have most of the following symptoms. Be neglectful of hygiene, may leave the refrigerator open and stove turned on for pots cooking, needs reminders to eat, needs help with choosing clothing and dressing, may put shoes on the wrong feet, put incorrect clothing on such as putting on pajama top over the sweater, needs help with bathing, shampooing hair, cleaning all body parts, episodes of incontinence, needs help with toileting, they may be even flushing and wiping incorrectly, driving becomes unsafe, may drive around for hours completely lost. Their behavior and their mood. Wandering has increased, restlessness and pacing aimlessly, changing sleep habits, sleeping during the day up until the night, increased irritation and angers easily due to frustration, increased suspiciousness, hallucinations, seeing or hearing things that are not there, increasing delusions, a fixed false belief based on the past person's beliefs he may get to school, or looking for the parent even though he's 80 years old. Loss of impulse control, whatever comes to the person's mind may be acted upon because he's forgotten about the consequences. Little concern about others, is he in his own world? Avoiding new situations, behaving inappropriately, going outside in sleepwear, rummaging and searching through belongings aimlessly and hoarding items more than can be used. For example, collecting napkins and stuffing them in a pocket, or taking a bunch of bananas and hiding them under the bed. Compulsiveness and repeated behaviors such as banging on the table may be combative, and then sundowning may occur, pacing in the late afternoon and evening. Cognition, unable to recall their address or telephone number, forgetful of recent events, confusion about time and day of the week, and the date and the season. This may be the first symptom the family members notice. Difficulty making even simple decisions. May take a long time to process. Complex decisions are no longer possible. Decreased concentration, cannot stay focused on a task for very long. Errors in judgment, walking down the middle of a busy highway, giving money to strangers. Difficulty communicating, increased mumbling, monotone expression, aphasia. Difficulty recognizing family and friends, or confusing one family member for another. Unable to correctly remember their past personal history. Stage 3, steps the person can take. Get daily exercise, share remaining memories with families, ask families to share their memories, stay involved in activities. And some of the steps the family can take. Also share memories, play daily exercise for the person, involve the person in activities, continue to allow the person to complete as many ADLs as the person is capable of doing. Provide dignity and respect, use prompts and cues, speak clearly and slowing using short one-step instructions. Stage 3 continued, and this is under the severe late stage, so we're approaching the late stages, which is stage 7. The short-term memory is no longer there. The person is no longer able to recognize family and friends. The language is absent. The person needs assistance with all ADLs. Swallowing is difficult. The person can often no longer ambulate. This is the final stage of the disease. This can last anywhere between 2 and 5 years. People with Alzheimer's live an average of 8 years after diagnosis, but may survive anywhere from 3 to 20 years. Generally, this is the stage that people are eligible for hospice with dementia. Some people are eligible for hospice before this stage due to their condition. Some of the cognitive things is, again, losing the ability to understand or use speech. The person may not be able to find a phrase. Memory loss. Memory is lost, both short and long-term is gone. Failure to recognize common items, cannot name an object. No recognition of their family or friends. Some abilities remain even in the late stage. The sense of touch, hearing, and ability to respond to others' emotions remain intact. The person will respond to affection from others and people talking in a calm, soothing voice. Music is one way to reach a person that is stroking pets may calm him or her. So in the later stages, you will know or notice that somebody that may not be able to communicate with you can still hear. So keep that in mind. They may not be able to communicate with you and or even express anything facially, but they can still hear what you are saying. Let's cover some of the caregiver's do's and don'ts. Don't treat a resident like children. Don't speak to them in a childish voice. Don't refer to them by nicknames like Susie, Billy, Grandma, etc. Do treat residents with respect that fits their age and experience. Always address a resident by Mr. or Mrs. unless given permission to do otherwise. Don't talk about residents in front of them. This is rude and assumes they don't have feelings. Do include residents in conversations and ask their opinions. Encourage them to make simple choices and express themselves by asking, "What does that mean to you?" Don't assume that just because a resident has dementia, that he doesn't care about their appearance. Do take time to have a resident help select their clothing and always make sure that the clothes is clean, fit well, and do not have their names showing. Hairstyles should be normal for their age, and women should have appropriate makeup and jewelry. Don't treat residents with disrespect. Don't rush them and pull them backwards in their wheelchairs. Do protect residents' right to privacy. Close their door when helping them and be sensitive to their feelings when assisting them with their ADLs. Don't assume residents have to follow your schedule. Do ensure that the residents' wake-up times and sleeping times fit their desired rights. Not everybody eats at the same time. Ensure the residents have some choice of their meal times and activities. Don't assume that because the resident has dementia, they are not interested in possessions. Do ensure that families provide residents mementos and comfort items. These items are protected from theft. Don't test residents' memory by asking them to identify persons, places, or things. Testing a resident's memory only serves to embarrass them and gives them the sense of failure that they failed to identify familiar people or objects. Do encourage residents to express themselves by sharing life stories and feelings. Don't patronize residents or assume they have no skills. Do ask residents to help you with tasks. Don't assume residents are sick or near death. Do ensure that residents are active and involved in as much as possible and get to enjoy as many new experiences as possible. Don't leave care and medical supplies out in resident areas. Do encourage residents to experience as home-like environment as possible. And don't be afraid to share your feelings with residents. Don't separate them from you.